Hi, welcome to Wins Pharma. Today's topic is prescription. What is prescription? Prescription is a written order from a registered medical practitioner or other licensed practitioner, for example, dentist, doctor, veterinarian, etc. The order is accompanied by directions for the pharmacist to prepare a specific type and quantity of preparation for a patient. This is a format where directions are given to the pharmacist to prepare a specific type and quantity of preparation for the patient. It also includes the direction for the patient regarding the mode of administration, how patient must take, in which route he must take. Those are also written. These are generally written in English language, but Latin words or abbreviations are frequently used at the same time. What are parts of prescription? There are many parts like date, name, age, sex and address of the patient, superscription, inscription, subscription, signature, renewal instructions, signature, address, registration number of the prescriber. Okay, these are parts of prescription, and now let's discuss about each type. Date here helps the pharmacist to find out the date of prescribing and date of presentation for filling the prescription. For example, the prescription which prescribed narcotic or other habit forming drugs must bear the date to avoid misuse. If narcotics or other habit forming drugs are present in the prescription, that must bear the date for compulsory. Next, coming to name, age, sex, address of the patient. These serves the identity of the prescription. If any of them, if any one of these are missing, the pharmacist can refill after proper inquiry from the patient. Age and sex. Age and sex of the patient is especially used in the case of children to help the pharmacist to check the prescribed dose of the medication. Next, body weight. A body weight of the patient may also require in order to calculate the appropriate dose. Next, coming to superscription. Superscription means the symbol RX, which is written before writing the prescription. RX means in Latin word you take. In olden days, they used to consider RX as the sign of Jupiter, that is god of healing, requesting God for quick recovery of the patient. What is inscription? Inscription is the main part of the prescription, which consists of names and quantities of the drugs, which is written in English with abbreviations in English and Latin. Then the name of each ingredient is written on separate line along with its quantity. Okay, the name is written in each line. Separate lines are written. In complex prescription with several ingredients, they write as ABC, that as base, adjuvant, vehicle. But nowadays, drugs are prescribed which are already in suitable formation. Pharmacists required to dispense ready-made form of drugs. So, compounding of prescription is almost eliminated. Here, inscription part is almost eliminated. That are where the directions of compounding of a drug is eliminated from the prescription. Now, coming to superscription. Superscription is preparing the prescription and number of doses to be dispensed. That means how much dose should be given to the patient. But nowadays prescribers are omitting the specific instructions to the pharmacist because prescriptions are not compounded and dispensed. Now, coming to signature. Here, administration of drug. This is a direction to administration of drug with following instructions, such as quantity to be taken, the frequency of administration, next mode of administration, special instructions on dilutions, like how much should be taken, how much quantity should be taken for how many times, like QID, TID, like that. Next, mode of administration: oral, subcutaneous, etc. And specific instructions like dilute in water, etc. Next, renewal instructions. Renewal instructions means prescriber indicate on every prescription order whether to renewed and how many times to be renewed. It is very important, particularly in prescription containing narcotics or habit forming drugs, to prevent misuse. Now coming to handling of prescription. What is handling of prescription? That is, when a pharmacist will when a patient visit the pharmacy to take his prescription drugs, the pharmacist take that prescription and he'll compound and dispense. So that is called handling. Handling have 4 steps: receiving, reading and checking, collection and weighing the materials, compounding, labeling and packing. Here, prescription. Receiving. Prescription should be received from the patient by the pharmacist himself. Pharmacist should not change his face expression like surprised or confusion. Pharmacist should not change his expression while giving the drugs, because that patient might get confused or he might be tensed. Then, reading and checking. First check it is in a proper format. If it is given in doctor's notepad or OPD slip or from the nursing home or signed by the prescriber along with the date, he should check. First step. Then prescription should be screened behind the counter. If counter is above, he should check here. Then, in case of any doubt regarding ingredients or directions, the pharmacist should consult the pharmacist or prescriber. But this matter, it should not be known to the patient. Whether he is calling to the doctor or prescriber, he should not inform. Pharmacist should never guess any of the meaning of any illegal or confused work. If pharmacist got any doubt in prescription, he should not guess any word. He should clarify it from pharmacist or prescriber. Sometimes prescription is received on telephone by senior pharmacist. In that cases, repeating and confirming 2-3 times, because sometimes pronunciation spelling with same manner might get confused. Such as, we'll see some examples come. Such as acidin, apidin, prednisone, prednisolone, digoxin, digitoxin, althrocin, L-throcin. Okay. So he must confirm 2-3 times. Next, collecting and weighing the material. Nowadays this step is eliminated, but in olden days we used to do this one. Everything was made ready to dispense nowadays. But in olden days we used to compound. All the material should be collected on the left side, and after weighing then shift to right side. While compounding, the label of every stock bottle should be read at least 2-3 times to avoid any error. When taken from the 2-3 times means 3 times. When taken from the shelf, contents removed after weighing and measuring, then containers returned back to the shelf. Then coming to the 4th step, compounding, labeling and packaging. What is then compounding at neat place is important. Equipment should be clean and dried. Only one prescription should be done at one time. All ingredients should be collected and compounded according to the direction as prescriber prescribed. Then compounded medication should be filled in suitable containers depending on its quantity and use. After filling, then label with white plain paper. The pharmacist should explain mode of administration, direction of use and storage. This is handling of prescription and prescription topic from pharmaceutics. Okay. Thank you for watching. Please like, comment and share. Wins Pharma.